My name is Samir Badaruddin. I'm an assistant professor at Department of Orthopedic Surgery at University of Kentucky. My partners and myself, we are all full-time employees of University of Kentucky. We are faculty members at University of Kentucky, but we work here at Bowling Green campus with the Medical Center Bowling Green on a full-time basis. So we work here. All our time is spent here at the local campus. My specialty focus is on joint replacement. I am a specialist in hip and knee replacement, so I do a lot of revision surgery, patients who have had hip or knee replacements elsewhere and who have problems with those hip and knee replacement, they come to me. So those are the revision work, those are the things I enjoy the most. Those complex cases where they already had a hip or knee replacement and they are not still quite satisfied. For instance, sometimes they might have an infection or sometimes their implants might be loose. But my focus is mainly on hip and knee replacement as both primary replacement, by which what I mean is patients who have really bad arthritis and they're coming for arthritis related problem. So initially we try to treat them with conservative treatment. So there are a lot of options available nowadays. We can give them injections into their affected joints. We can give them great physical therapy, anti-inflammatory medications. When those things don't work, that's when we think about surgery. So that's one area I focus on. And then the other area is where people come with a painful artificial joint in their hip or knee, and then we have to figure out why that happened, why they are still hurting. So that's kind of an investigative detective work, trying to figure out what exactly happened, why it is hurting. And that's intellectually very, very stimulating. And also now we have a new system in our hospital here, which is a robotic assisted surgery. So it is only in 3 places in Kentucky that they have it. So what we have is a robot that helps us to place this artificial joint in a really perfect position. So we can possibly decrease the complications that can happen with those hip and knee replacements. The favorite thing about my job is that the instant relief that you can give your patients. If it is I've had patients who have hip replacement who would say that as soon as their surgery is done, they are in the recovery room, they can feel the nearly instantaneous relief of symptoms. Joint replacement surgery is a quality of life surgery. It is an elective quality of life surgery. It changes people's quality of life instantaneously. So people who have not been able to play with their grandkids, people who have not been able to maintain a gainful employment, they suddenly can do that. So it's a life-changing surgery. If you compare with other surgeries, the hip replacement is the most valuable in terms of changing people's quality of life among all the surgeries mankind have figured out. So it's a truly amazing, life-changing surgery, and I'm so fortunate to be able to do that for my patients.